Okay, and if I'm not mistaken, we are live. Thank you so much for being with us right now. My name is Dr. Chad Kuntz, and I'm the founder and owner as well of Prime Movement. We are a premium physical therapy-based practice out of Southern Charlotte, and I'm going to walk you through the 5 unconventional piriformis stretches to help you jumpstart sciatica, hip, and lower back pain relief. So this is a super hot topic. We tend to treat a lot of people that have had or are currently suffering from piriformis pains, nerve problems, including sciatica, including hip and lower back problems. So we see that kind of cohort of people a lot. And in fact, people were continuing to request more and more information. So I decided to create kind of this online educational workshop to be able to reach out to more people and kind of show you what you guys can start to do right now if you're suffering from sciatica, piriformis syndrome, hip pain or tightness or aches, or if you're suffering from lower back pain or tightness as well. So this is a kind of a jam-packed session. Let's kind of get into a little bit. So again, my name is Dr. Chad Kuntz. I've helped hundreds, if not thousands of people who are suffering from piriformis problems, low back, just a couple pictures there. And I wanted to say thank you so much for being with us again. It really means the world to us. And I'm going to actually ask about you right now. So who's here? So before we get started, I want to know who's here. Feel free to type in the chat why you're here and what problem you hope to solve or you hope that we can solve for you right now, whether that's lower back pain or sciatica. And I'm just going to kind of take a look here as you guys are chatting in. So John, he's suffering from sciatica. Looks like Harris has a lower back problem, more nerve-related problems, lower back, hip pain, piriformis syndrome. Kyle has tight lower back. So yeah, and it looks like a lot of people are filing in right now, which is fantastic. This exceeds our expectations. It looks like we're right around 300 people in climbing, so this is fantastic. Hopefully everything goes smoothly here tonight so that you guys can get all the information you need. So thank you guys for that information, and you can continue to kind of pour in the comments as we move through. So I wanted to just introduce a couple of fun facts that I think you guys should know about, and we'll briefly go over an anatomical review to make sure you understand from an anatomy perspective kind of what we're dealing with here. And then I think there's some solace knowing that up to 84% of people will experience low back pain within their lifetime. All right, so I'm not good at math, but out of the 300 here, let's just say 84% of people will suffer with low back pain alone. So we also have hip problems here or sciatica here. So that's just low back pain. So that's a lot of people, all right? So understand that this is a very common thing, but what needs to happen is to make sure that we can get you out of there and you're not worried about it too much. You're able to recover. This other fun fact I wanted to walk you through is that 28% of people still report symptoms 12 months after their sciatica and back injury. And that's the problem right here, ladies and gentlemen. 84% of people may have that problem, particularly with low back pain. But 30% of people are still suffering from it 12 months after their back injury. That's just way too long and way too many people to be suffering with that. And then a fun fact I want you to know about is that the piriformis is actually pierced by the sciatica nerve up to 14%. So this is an anomaly. Look at down here. This would be underneath D. Look at how that sciatica nerve goes right through the piriformis. All right, so that anomaly might increase the chance that you suffer from sciatica because that nerve is coursing right through it. Underneath A, that would be more of what a normalized sciatica nerve would look like in terms of its distribution. And then you can see that not all nerves are created equal. The sciatica nerve has some different anomalies and variations that I think you guys should know about. All right, so let's go ahead and jump right into the brief look here at the anatomy of it. All right, so let me go ahead and turn that off. There we go. All right, so this is just looking from the back view, looking in, and we're going to jump right into that sciatica nerve. And I want you to really appreciate the size of that nerve. I mean, it is really enormous. You can see how multiple nerves come together. And as it heads down, I want to just show you and let you appreciate how it splits into different nerves. Okay, so that one kind of courses around the front side, that'll actually run down the front of your shin. So people are like having problems in the front of their shin from the sciatic nerve. Is that possible? Absolutely it is, because you can see here quite clearly it splits into a few different nerve roots, and it continues to expand down the leg. This is the tibial nerve, and that's more of a classic sciatica distribution. It'll actually run, let me just see if I can show you here. It'll actually run on the bottom of the foot and splits again into your medial and then lateral plantar nerves. So, can sciatica actually cause problems all the way down into the bottom of the arch and into the foot? It absolutely can. But we have to appreciate kind of where it starts and the muscles that course around it. The basis of today's educational workshop, we're going to show you how to stretch this muscle right here, the piriformis muscle, which tends to cause a lot of problems with those who have sciatica. We're going to show you a bunch of different ways. Now look at, there's not much space back there. So you can see how a really tight muscle could cause some congestion. We also tend to find that this big muscle, the glute max, can also get really tight and cause some problems. So some of what you'll find with our stretching today is to stretch out the glute max. Now, as we zoom in, just look at how complicated this is, and look at all the different nerve bundles. It's amazing how much is going on here. The point I'd like to also make is that we need to keep the spacing appropriate in the lower spine. So that's kind of where it originates. And on average, I want to say off the top of my head, it's somewhere between like 10 to 13 millimeters of space that nerve has. That's not a whole lot. So while we need to stretch out the buttock and the piriformis, we need to make sure that we're also keeping the intervertebral space happy in your lower back. And so that's something that is really worth noting, because a lot of times we'll help people who have sciatica by also treating their lower back. So I hope that helped to kind of quickly go into the review of the anatomy. Let's go ahead and get started. So there's 5 stretches and movements that are pretty unique, unconventional, and want to make sure that you guys feel really good about trying these out. So you're welcome to try some of these out right now as we go through with it. If you have any questions or comments about any of these, just put them in the comment box or email me at chadk@primemovement.com. As you had received emails leading up to this today, be a lookout for an email later on after this. I'll probably guess around 12 to 24 hours after this, I'll shoot you a recording of this through a YouTube file. That way you could kind of pause and play it and go back and forth if you wanted to try out these movements again. The first one we're getting started with is called the corner pocket stretch. So let's go ahead and get started. Again, for those that would like to try out this during, feel free, go for it. So for the corner pocket stretch, you're going to get into your hands and knees. And as you can see right there, I'm going to pause it. The side I'm stretching will be this left side. So I'm on my hands and knees. I've crossed my left heel over my right shin, and I'm getting a really good elongation through my lower left back and buttocks. So you want to bring your butt down and away. So it's not like maybe a traditional child's pose where you only go down. You're actually bringing the butt away from the body. So you can see my left arm's reaching up across my body. My butt is sinking down and back. And when I do that, we're stretching the lats. You're like, well, wait a minute, I'm here to stretch my piriformis. Well, remember, the lats connect into the thoracolumbar fascia, and there are significant fascial linings all the way into the glute max and into the deeper muscles like the piriformis. So it's really important that we stretch out all the big muscles, including the piriformis. So again, I'm sinking down and back. I'm trying to keep my spine relatively straight. This is just a quick speed up version of it. And that's about as low as I can go. And my left glute and piriformis is feeling a really good stretch when I do that. And it's just another quick view for you. I'm reaching up and across, sinking down and back. And look at how I'm kind of moving away, my left cheek away, and I'm kind of side bending a little bit. And that felt like a really good stretch into that left glute and piriformis area. I would suggest that you perform 10-second holds at your end range. Again, with any questions on these, just please feel free to put in the comment. I do prefer email as well, so you could just jot any questions down and email it. That way we can have a better ongoing discussion afterwards. but that is a corner pocket stretch. I'm going to show you 5 because I know that not every stretch is created equal. All of our bodies are different, right? And so we have to treat that so, and we have to give you guys different tastes, different movements, different options. Some of you may have really bad knee pain, and you're unable to get into that position, so you've already written that one off. But for some of you, that looks like the perfect stretch. So that's why we need to kind of really show you and give you some options, and maybe some options that you've never tried before, to make sure that we can figure out that relief that you're looking for. So this next one is a lying down piriformis stretch. So this one is lying down. And I'm going to be using just this little setup here. This, quite frankly, could be on your bed. This could be on your sofa. And what you'll do is you're going to grab, I'll actually rewind that a little bit since I was talking. So what you'll do is actually grab your ankle and pull it up and across towards your opposite shoulder. So if I'm stretching my right glute and piriformis and hip out, I'm going to be pulling my right hip up towards my chest and towards my outside left shoulder. If you're unable to grab that, like my left hand is doing so, then we encourage to use a stretch rope. And this is something that we offer here at our location. We can give you stretch ropes as needed. But let's say that you were okay with that. So this does require, and yes, I'm stretching my lower right piriformis area, but this actually does require a lot of strength to some extent with your upper body to pull your knee all the way firmly towards your chest. And also I want to make a note here too, so the height that you're doing this on does matter. So right there, I'm not too elevated off the ground. But if I'm a little higher up, like you can see here, so the risers that I was able to manipulate, I increased that. So now my left hip is in more extension. What does that mean? It means my right hip has to go into even more hip flexion. And I did feel a much significantly greater stretch here on the right side because I was elevated. So keep that in mind if you're doing this off your bed or off the sofa, that the height does matter. You might have to kind of play around with that to figure out what's going to be the best scenario for your stretch. So you want to perform 5 15-second holds with this one. Of course, almost with all these, you want to make sure that you're doing some nice deep breathing. So what's great is that the pros on this one is that you can do it when lying down. It's very simple. It does actually take a decent amount of upper body strength to really pull that tight muscle all the way up. But that's the second one I wanted to go through. Okay. All right. Looks like questions are pouring in, and I will get to those after this educational workshop. By the way, if you guys hang around long enough, there's kind of a bonus that I wanted to walk through at the very end. So keep that in mind. It looks like we're still sitting around the very high 200s, so a little over 280 people here still with us. So I appreciate you guys hanging around. Hopefully this is valuable. If you find that this is helpful, just comment below, and that'll let me know that we're giving you what you need. It looks like valuable, great, perfect, fantastic. So we're going to move into the 90-90 leans. This is a third and alternative way to stretch out your piriformis to help loosen up your sciatica or your low back pain or whatever it may be. And just take a second to appreciate our different starting positions, right? We did one on our hands and knees. The second one we did lying on our back. And the third one, quite unconventional. We're going to actually start out in a side-seated position. Some of you haven't even been in this type of position since kindergarten, right? So it can be a long time since you've even tried some of these different type of movements. So while keeping the spine erect or tall, you're going to lean your heart forwards. I tend to find a lot of people make the mistake that they curve their spine too much. With this stretch, we really want to keep that spine straight, as if you're kind of showing your chest or standing up tall. You would like to do that as you lean your heart forwards. Otherwise, you might miss out on this one. I feel the stretch in my left glute, so since my left hip is going into external rotation, my right hip is back. And therefore, I feel a really good stretch with that. This is kind of me just showing you, if you're having a really tough time even getting into the position, a small movement may be all that you need, okay? Just like that, I've treated a lot of people who have dealt with kind of an irritable sciatic nerve or really tight piriformis, and this is about all they needed, and they were really feeling a great stretch with that. And that's what we're after. Everyone's a little bit different. I would suggest doing 10-second holds with this if possible. Take all of that with a grain of salt, just because every person's a little bit different. And let's say you get to the bottom of that stretch and it felt really, really good. So hang in there a little bit longer. Feel free to watch a full commercials, 2 to 3 minutes while you're in that position. So those are the 90-90 leans. With any questions, keep posting it below. So we've done the corner pocket, the lying piriformis stretch, the 90-90 leans, and this one's really unique. I think you guys are going to like this one. This is a personal touch of mine that I've found really useful for my tight hips and my tight piriformis. And ideally, you will use or need a foam roller. So this does include an accessory. So a lot of people seem to have foam rollers lying around. Well, we're going to use it not necessarily for foam rolling. That's a whole other topic and debate. But really, we're going to just use this to kind of help prop our hip up and to help get us a better stretch into the piriformis and glutes. I pause this because I want you to know it's very important to keep your front knee bent to 90 degrees, as we've kind of illustrated here with those red lines. A lot of people tend to pull their heel too close to the butt. The knee is at more than 100 or 120 degrees, and you won't get this same hip stretch. But look at how the femur and the thigh line up perfectly with that, and that's what I want you guys to try at home. This is much more of an active and dynamic way of going about it, and we use kind of an indirect method to get it. So let me show you. So while you're keeping your spine straight, while you've brought your back knee to the ground, look at how I'm going to straighten that back right knee. And what happens, and what you'll try this out, is as I'm straightening my knee, you're going to actually feel the stretch in your front left, or in this case, my front left piriformis. And I'm actually stretching out my back right hip flexor. This is really cool because you get 2 birds in 1 stone. Look at me, how I was able to sink down more after I had done a few reps. So I feel my right glutes working really hard there. I feel one heck of a really good stretch. My right foot, by the way, isn't rotated or pointed out. My toes are pointed straight up. And I like to encourage 10 knee lifts with a 1 to 2 second hold. So this one might be a little bit more advanced. You could kind of put it like that. It's definitely much more dynamic. But someone out there watching this will go back and they'll catch it on the YouTube video when I send you the email. Maybe they have more time to try it out. And they might find that this is the one that they really needed. And I've seen that when working with our clientele. So I didn't want to hold that one back from you. It's super unorthodox and unconventional. But I've had a ton of success with it with the right person. And so with that being said, we're down to just one more. This was a pretty fun one too. It's called the seated piriformis leans. Okay, and we do also, I did want to kind of throw in the reach component to it. So what I'll do is go ahead and get started with this. So this is a pretty cool, and what's nice about this is that you just need to be seated. All right, a lot of you are sitting down. You can actually try some of these initial moves right away just because of the practicality of it and the convenience. So you'll be seated. You'll pull the leg that you want to stretch up and over and across. Make sure that your shin bone kind of sits comfortably on the opposite thigh. Once you're there, to get started, you want to go ahead and slowly keep your spine straight. You want to lean forwards, all right? And you want to feel that really good stretch, okay? So in this case, I'm stretching out my lower right glute. And as I said there again, I'm just reiterating the importance. Keep your spine straight. Don't flex yet. And what you'll see by that is with the reach, there's a small variation where I allow you to. So if I'm truly going after just a good musculoskeletal stretch, keeping your spine straight will really help. I encourage you to take really big, deep breaths in. Exhale, get you to the end range and feel a really good stretch. You can also put your hand behind your low back as well. That'll keep your spine from flexing. So when you're just trying to get a good rudimentary stretch into the hip, keeping your hand behind your back, holding it for 30 seconds, and repeating for 5 times can be wonderful. Now, for those who need to stretch their nerve out, so if you feel like you've got more of a nervy, burning, tingling problem, I actually encourage our clients to do this. So reach through your leg and reach as low as you can go. We're going to allow you to flex the spine at this point. Because when you flex the spine, you're actually stretching out the nerve. And I've seen some pretty good improvements with our clients just on around 10 reaches or so. Now, it doesn't mean that it's not uncomfortable or like you're feeling something. People are feeling a lot. And that's usually a motion that people are kind of tentative to do, is that flexion moment after they hurt their back or have sciatica. So that one kind of warms up the nerve and stretches it. So yeah, I would even suggest start out with the leans, and then you could progress into the reaches to kind of really tap into both the muscles and the tight nerves. Okay, so for those 260 plus of you that are still around, I wanted to provide you guys a bonus for sticking around this long. And I wanted to ask you, what do you think is next for you? Do you need to continue what you're doing? Do you want to just keep looking up do-it-yourself techniques on YouTube? Or we're here to help show you the way. That's certainly a possibility. And we'd like to offer you one of our prime assessments. And we think that this would really be a great next step for those who would like our help. So what's included in our prime assessment? It's a full 1 hour long assessment. This would be specific to your back, but not only back, hip pain problems, sciatica, piriformis problems. And just to kind of give you a little bit of an idea of how we'd spend our time together. We want to get to know you. We want to get to understand your story. Every person is different, and that's so important to understand initially how you heard it and the history behind that. We go through an extensive postural examination. I'm sure all of you know how important posture is. And then functional examination is like, all right, let's start to see how you move. Let's see how you squat. If it's applicable, let's see how you do lunges. Let's see how you touch your toes, so on and so forth. We can then move into a strength assessment. I'm sure you know how important a good, strong core is, or if your core is firing. And that's something we can also include in our strength assessment. And then understanding your joint quality. So a lot of people are getting manipulated through their spine through other healthcare providers, but we also like to assess the joints. Where are you tight? Where are you limited? How can we mobilize those joints? Whereas some joints move too easily. And we might need to just focus on stability and using more of your core for those. All right, so we'll also take our time to analyze you and analyze that functional examination. So we'll actually show you on a big TV screen that we've got right here. How are you touching your toes even? Are you doing that the right way? How are you sitting? Could you do that better? How are you squatting? And we can make some significant improvements just based upon your movement quality. It's really important to us that we educate you on what your proper diagnosis is. A lot of you have been diagnosed already, but a lot of you have also had self-diagnosis. So we can validate that, or we can say, you know what, I don't think this is a piriformis syndrome. I think it's a X and Y problem. Or I don't think it's a bulging disc. I think you just have tight muscles. And it's really important that you guys know exactly what we think the diagnosis is from a clinical perspective and what we can do about it. We can begin right away with a stretching and strengthening program, which has been super helpful for our clients, especially knowing what to do right away so they're not hurting themselves any further, as well as do's or don'ts. So sometimes people are doing things that are bothering it on a daily basis, and they had no idea that something so simple was doing that. So we need to take away those perpetuating factors, and then we, at the very minimum, need to provide you a customized plan, because not every back, hip, or sciatica is different, or is the same, excuse me. So what we'd actually like to offer you, for those that are still around, is a free prime assessment. So that's a $239 value. We've got 10 spots left right now that we can hold for this, and I'm only going to offer it for the next 10 minutes because I want those who are really serious to be able to take advantage of that. So while I wrap up, feel free to click on the offer right there in the chat box, and you can open it up if it's not showing you, and that'll kind of take you to a place where you could provide some information. We can get a hold of you, and if we've got any spots left, we can go ahead and get you in. So what I wanted to do now is actually go over a quick success story that I think you guys will resonate with. And it was just an absolute pleasure working with this gentleman. He's back to golfing, working full time, and just doing everyday life without even thinking about it. And sometimes we take that so for granted. And again, I thought this success story was pretty similar to what a lot of you have been going through. In fact, if you take a look at this top left, he said, my lower back and sciatica nerve was so painful. It was hard for me to get in and out of bed and my car. And look, we literally took the time to go assess how he was getting in and out of the car, because it was such a problem for him. And guess what? We found out that he was actually getting in and out of the car, which you would think is such a simple maneuver, but he was actually doing it the wrong way. Once we corrected that, we stopped a perpetuating factor. In other words, we stopped something that was bothering him on a daily basis or was worsening the inflammation in and around his lower back and in and around his sciatica nerve. Once we calmed that down, we actually really took off. So that's kind of what I was saying earlier. It's something so simple that we don't think about where you really need an expert to kind of evaluate and thoroughly assess what you're doing on a daily basis the entire day, because you'd be surprised what you might be doing. But nonetheless, being on his feet wasn't so bad. I was just sitting down in the chair. So he really couldn't tolerate sitting at all. He benefited from that seated stretch where you actually allow the spine to flex. So his wasn't just that he had a tight piriformis muscle, but we actually had to floss the nerve. And honestly, what I love that he said down here at the bottom is that we get to the root of the problem. His root of the problem was multifactorial. It was the way he was sleeping. It was the way he was getting in and out of bed. It was the way that he was getting in and out of his car. It was the way he was standing. It was the lack of core strength. It was his nerve tightness. So it was all these things that composed the root of the problem that was, once we addressed that, allowed him to get back to doing what he wanted to do. So anyways, I thank you guys so much for being here with me. And we covered the 5 unconventional piriformis stretches to help you jumpstart sciatica, hip, and lower back pain relief. We still have a ton of people on, so thank you so much. We do only have 10 spots. If you're on the fence, at the very minimum, fill that information out. We could have a conversation to make sure that we are a great fit for you. Be on the lookout for a YouTube link of this recording so you could go back and try those videos out and try those exercises out, because I don't have those anywhere else. That's just for you guys who are really serious that hopped on here with me, and I want to make sure that you had only the best information out there. So with that being said, thank you so much and take care.